Before we jump into the workflow, let's quickly frame the challenge healthcare providers are facing today. Revenue cycle teams are under pressure from three directions. Denials are increasing. Around 20% of medical claims are denied, putting millions of dollars of revenue at risk. Recovering that revenue is expensive. Providers spend over $140 billion each year on revenue cycle operations, roughly 3 to 4% of the total health system revenue. The work is incredibly manual. Staff move from EHRs, billing systems, payer portals, and documentation just to understand why a claim was denied. What makes it even more frustrating is that more than half of appealed denials are ultimately overturned. The revenue is often recoverable, but the process of finding the evidence, writing the appeal, and submitting it takes enormous time and effort. This is exactly the problem our claim denial prevention and resolution solution is designed to solve. So let's step into the shoes of someone dealing with this every day. Meet Alex, a clinical denials specialist. Alex begins the day by opening her denial work queue. Instead of searching across multiple systems, she sees a prioritized list of claims that require attention, along with the total value of revenue at risk. The system automatically sorts claims by value and highlights upcoming appeal deadlines. That's important because once these deadlines pass, the revenue is permanently written off. Alex selects a claim to review. At this point, the platform has already gathered the relevant information from multiple systems behind the scenes. Several agents are working together to organize the denial. One reviews the remittance data from the payer to identify denial reason. Another checks the payer's most current policy requirements. A third scans the patient's clinical documentation to identify evidence supporting the treatment. Instead of Alex manually searching through records and policies, the system assembles the context and presents a recommendation. In this case, the claim was denied for medical necessity, but the system has already identified supporting evidence in the payer's vitals, labs, and EKG results. It has also compared this case to historical appeal outcomes and payer policy rules to estimate the likelihood that an appeal would succeed. Alex can immediately see that this claim is worth pursuing, along with the potential recovery amount. Importantly, every recommendation is transparent. Alex can open any finding to trace back to the original documentation, building confidence in the system's analysis. Once Alex decides to proceed, the next step is generating the appeal letter. An AI agent drafts the letter automatically using the clinical evidence already identified. The argument is structured clearly and formatted according to the payer's requirements. Alex reviews the draft, makes any edits if needed, and approves it. After approval, the automation handles the submission process. An EDI whether the payer requires a portal submission, an EDI transaction, or even fax. Each payer has different processes, and the system ensures the appeal package is delivered correctly. What previously took hours of research and writing can now happen in minutes. Resolving denials is only part of the value. One of the most powerful aspects of the solution is the ability to identify patterns across denials. Each denial processed by the system becomes part of a larger data set that helps identify root causes. For example, Alex might discover that a large group of denials from a specific payer is tied to missing modifiers for procedures within certain DRGs. Instead of continuing to react to each denial individually, the system highlights this pattern and estimates the revenue impact of fixing it upstream. By adjusting the claim submission process before claims are sent, the organization can prevent these denials entirely, reducing downstream work and accelerating revenue capture. Finally, leadership can see the financial impact of these improvements. The dashboard provides CFOs and revenue cycle leaders with visibility into key metrics, how much revenue is being recovered and how quickly appeals are resolved, and where denial patterns are emerging across payers and locations. For health systems, this level of insight is critical. Denials can sit in accounts receivable for months, and once appeal deadlines pass, the revenue is lost forever. Users can also chat with the denials and ask questions about aggregate details of like the top 10 denials by amount, or questions specific to an individual claim. With UiPath's prevention and resolution solution, teams like Alex's can work faster, focus on the claims that matter most, and recover revenue that would otherwise be written off, while reducing the administrative burden across the revenue cycle.